Alrighty, thank you to Dr. Eichenfield, and thank you to the American Acne and Rosacea Symposium for allowing me to present my team's collaborative research efforts today. So institutional support for the study was provided by the Perfect Skincare Pro Corporation. I myself have no personal conflicts of interest to disclose. So acne vulgaris is one of the most prevalent dermatologic conditions. Clinical presentations often involve erythematous papules, pustules, or nodules, primarily on the face, chest, and back. Facial involvement in acne can be particularly bothersome to some patients, often affecting their self-esteem. Facial acne also may present differently in patients. Therefore, tailoring acne treatment often is based on the needs of the severity of acne in patients. As we've seen clinically, responses to a treatment may vary from patient to patient as well. So understanding how facial characteristics are processed, both based on quantity, distribution, and intensity, may be of clinical value. This is where facial AI systems can help us clinicians monitor acne progression through analysis of focused facial characteristics, including wrinkles, redness, texture, spots, dark circles, and overall skin health, among other characteristics. And we believed that analysis of facial characteristics in a clinical setting may help us both determine a baseline marker as well as gauge treatment responses for our acne patients. So we aim to validate a facial AI technology in detecting changes in facial acne. Alrighty, so for our study, we recruited 10 patients over the age of 11 that were starting a personalized acne treatment, and these patients were recruited from various Wake Forest dermatology clinics. We obtained multiple facial images using 2 AI systems. So the first one was the Perfect Skincare AI, which is an iPad-based tool, and I will provide more information regarding this system in the next slide. The second system that we used was a validated computer-based AI, which is known as Vizia, and this is traditionally considered the gold standard in terms of clinical facial assessments. Additionally, for both of the systems, we performed all images in a clinical photography room, and we made sure to standardize lighting settings, as you can observe in the bottom right corner. The way Perfect works is it takes a picture and immediately provides us with a raw score, and the lower the raw score indicates less desirable skin characteristics. So we chose skin characteristics that were of primary concern to patients with acne. So for primary outcomes, we aim to determine changes in facial redness and pores, and then our secondary outcomes were changes in facial texture. We compared these changes both at baseline and then 8 weeks after starting acne treatment. And additionally, we did provide physician assessments at the end of every patient clinic visit, and then we used these for comparison to the scores produced by the AI as well. Okay, so to go a little bit more in depth into the AI interface, so it is an iPad-based AI. It relies on iOS compatibility, and it does need Wi-Fi access as well in order for its algorithm to process the data. What makes this particular AI unique is its deep neural network DNN algorithm, which is used to process external inputs. It is also able to analyze patterns and then predict outputs for 14 facial characteristics, including brown and red UV spots, redness, wrinkles, pores, moisture, oiliness, and then it does have a focused acne measure as well, in addition to texture, dark circles, and then common eye involvement such as droopy upper or lower eyelids, and then facial radiance as well. So the DNN algorithm has been trained on input of over 70,000 images from various ethnic backgrounds, and as of last year, it was validated across Fitzpatrick skin types 1 through 6. And then previous studies within our research center at Wake Forest has also supported the use of this particular AI in monitoring treatment for patients with rosacea and melasma. Okay, so actually, let me go back. So the image to the right is an example of the assessment it gives. So I focused particularly on the acne characteristic here. And when you press on it, one of the key features of this AI is that it is not only able to locate the lesions, but give you a quantification of how many of each subtype. So it classifies it into blackhead, whitehead, and then inflammatory acne. Alrighty, and then this right here are the results for one of our patients who she presented with erythematous comedonal lesions on her face as well as atrophic scarring. We're able to note that after 8 weeks of treatment with topical therapy, her score significantly improved. So primarily for redness, the scores increased from the 78th to the 81st percentile. Also, texture increased from the 66th to the 77th percentile. However, we found that pores stayed the same at 77th percentile. We noted similar trends for the majority of our other patients. So the changes in mean raw score for facial redness indicated a statistically significant improvement from baseline to final visits after 8 weeks. And then the scores for pores, however, remained the same during the duration of our study. Our secondary endpoint, which was texture, did result in a statistically significant improvement from baseline to 8 weeks after treatment. And then finally, for the physician assessments that we compared the Perfect AI scores, we found that there was a mean concordance rate of 70% across all 14 facial characteristics. However, for the characteristics that our study particularly focused on, facial redness and texture had the highest agreeance. And then redness was at 84%, and it did present with a statistically significant value. And then overall, I think this study indicates that facial AI technology can capture change in facial redness, pores, and textures in patients with acne. For us, myself in particular, I found it to be a very fast, practical, and effective tool. The way that it provided both clinicians and then patients with an initial assessment and then allowed us to gauge whether or not the treatment was appropriate and if not, seek alternatives. I think that that's something of huge use. And then we believe that the fact that the AI is able to generate reliable scores may be a valuable research and clinical tool for dermatologists to help assess both baseline skin metrics and then track skin concerns for various acne patients in the future. We also found this particular tool to be very convenient and user-friendly. It's also pretty cost-effective in comparison to the other AI alternatives out there. We hope that in the future we can support the use of this AI in a home setting and allow clinical trial inclusion for patients to be able to monitor their own symptoms and progression at home. Those are my references. And then we would like to thank the CTSI department at the Wake Forest School of Medicine for processing all of our data, as well as Dr. Feldman and his incredible research team at the Center for Dermatology Research Center at Wake Forest.